aspects, let's go. First, the agenda for today. The agenda, we start with some information about the THCS partnership. The coordination team will tell you more about it. Further on, the call development team will tell you more about the background of this call text. I will tell you more about the procedures and also how we look at patient and end user involvement. Our colleague from the work package 9 about ecosystems within THCS. She will tell you more about the importance of an ecosystem-wide approach. And we end up with an explanation on the partner search tool. So that will help you to find partners for your consortium. And as I said, we end up with a Q&A, and we'll see how we can answer most of your questions. Well, that's the plan for today. I want to give the floor now to Federico to give some more information about the THCS partnership.
Good afternoon, everyone. Thank you very much, Edward, for your presentation. I will share my screen and I will guide you through what is THCS, who we are, what we are doing. So let's start by saying what is THCS. THCS is a European partnership under Pillar 2 of Horizon Europe within the health cluster. It is a co-funded partnership. It means that it pulls together resources from national and regional funding agencies together with a 30% top-up by the European Commission. In this sense, like all Horizon Europe partnerships, THCS is a strategic tool for the European Commission and member states alike to pursue research and innovation priorities in a more synergic manner, making sure that the certain topics which are not covered by the Horizon Europe annual work plans are anyhow funded through these other tools. But more, THCS is also more than this, because it's not just a funding mechanism. It is a coordinated approach that involves also other activities, and we're going to see them later, to tackling the challenges of health and care systems in Europe and beyond, challenges that obviously no single country and nor the European Commission can solve alone. And now that we know what THCS is, let's look at who we are. THCS brings together more than 60 partners from 26 countries, including Ministry of Health, Ministry of Research, national and regional funding agencies, innovation agencies, all stakeholders working with and for health and care systems. The THCS partnership is led by the Italian Ministry of Health, which coordinates the consortium. Has a 7 years span, and it's running. It started in 2023. It will run until 2029, and it has a planned budget of a little bit over than 300 million euros, which, as said, are co-funded at 30% by the European Commission. In this sense, you can understand that THCS is a very ambitious collaboration at European level, which is trying to align national, regional, and European efforts towards shared goals. Let's get now at the objective of THCS. As you might understand also from the name, from the acronym itself, so Transforming Health and Care Systems, the overarching objective of our partnership is to support the transitions towards more sustainable, efficient, resilient, inclusive, and innovative people-centered health and care systems, accessible to everyone. And this, you're going to see it reflected, especially in the Joint National Call we have launched this year. In other words, what we want to do is to help countries strengthening their systems so they can be more resilient and respond better to the current and future health and care challenges. We are doing this by building this open and collaborative partnership where we put around the same table different stakeholders, researchers, like most of you, I guess, are, but also practitioners, policymakers, who can work together to stimulate and guide the research and innovation for health and care system transformation. To reach these ambitious objectives, THCS does not only fund research, but much more. And in this slide, you can see the comprehensive approach we have built and which revolves around three main work streams. So our first work stream is filling the knowledge gap. And within this work stream, we support research and innovation actions that generate evidence that we need to understand systemic challenges and identify what, why, and how works. The second stream is the implementation and transfer to help existing solutions that are already in place in different national and regional contexts to see if they are adaptable and to help them to be transferred in other territories in Europe. And the third work stream is boosting system capacity. And this, we are doing it with capacity building through training programs, study visits, technical assistance, twinning, networking, and to reach the objective of strengthening ecosystems all around Europe to ensure that all countries and regions have the skills and tools needed to adopt innovation. And with these three work streams, this is our idea to support the full innovation journey from evidence to implementation. To deliver these work streams, obviously, these three objectives are mirrored also in our internal structure. THCS is organized around 4 pillars, each addressing different types of activities within the health and care innovation journey that we have described before. We have Pillar 0, obviously, the program management. We have Pillar 2, which is, let's say, our core business and is the one dealing with the joint national calls, like the one you're here to listen about today. We have then other 2 pillars, science and innovation into policy and practice, and support transferability and strengthening ecosystem, which are exactly mirroring the 3 work streams that we have seen before. These 4 pillars, 3 plus 1, are implemented through 10 work package, as you can see. And this structure ensures that everything we do is aligned and it's mutually reinforcing and clear within a larger framework of action. Despite having started only in 2023, THCS partnership has already made substantial progress. And in this slide, I just want to give you some figures about what we have done so far. So first of all, through our first 3 joint transnational calls, and I will show you more in the next slide about this, we have funded more than 60 international research projects. And you can find everything on our website, but I will tell you more later. What else? We have created also a knowledge hub, and the link will be given to you in the last slide. This knowledge hub is a central space where we are storing evidence.
Bonjour Guillaume, c'est Lara Gervais de la startup Virtuosis Hub.
Central space where evidence, outcomes, and tools across Europe can be shared and translated into knowledge. We also have designed frameworks for transferring good practices and also frameworks, this is under developing right now, to help policymakers turn research fundings into real reforms, so evidence into action. But more, we have also traveled across Europe to find and learn about successful cases of transformative ecosystems. And last but not least, we are investing in capacity building. As said before, we are working a lot around themes like leadership, digital readiness, workforce resilience, to make sure that innovation, when ready, when available, will be ready to be uptaken. As many of you are here today about the new Joint National Call, as said, it might be useful and interesting to look back at the topics of our previous calls. This is the fourth one that we are launching. And maybe also in this way we can give you the sense a bit of the strategic direction that THCS is following. So in 2023, our first Joint National Call was named Healthcare of the Future, and it focused on generating evidence and solutions to build the health and care systems for tomorrow. Projects explore new models of care, digital tools, innovation, and it was a rather large topic that we funded with more than 30 million euros from 36 funders. And you can see, if you follow the QR code and on our website, but all of these slides will be shared with you after the webinar. You can see which kind of projects we have funded in 2023. The Joint National Call 2025, on the other hand, Innovate to Prevent, was more focusing on prevention strategies. Also in this case, as it is our one of our main strong points, we wanted to do so by harnessing digital technologies, data, AI, and other disruptive technologies to strengthen early detection and tailor intervention for early prevention strategies. In 2025, with better care closer to home, on the other hand, we target primary and community care, supporting projects that were focusing on system shifts from hospitals to community settings. And also, and this was the second step, providing policymakers with tools to manage these transitions. So, as you can see, this is our strategic direction, and also you can see how we are trying to fund projects across the full spectrum of health and care system transformation. And with this, I get to the conclusion of my brief introduction to what THCS is. Thank you very much for your attention. In this slide, you can see all the addresses of our website, LinkedIn page, YouTube page, where also we're going to upload the recordings of this meeting. also on the website, obviously, but they're going to be also on our YouTube page, and where also you can find introductory video of JTC 2026. If you have more questions, you can write both to the email that Edward was showing you before, Zon, but also to info@thcspartnership.eu. And last but not least, visit also our Knowledge Hub, where you can find very interesting solutions from all over Europe who are already in place, and also in our ideas it will become a nice community where sharing innovative ideas for health and care system transformation. We look forward to receiving your proposals, obviously. Thank you once again, and good luck.
And I give the floor now to Jostein to give more of the explanation on the call text.
Thank you very much. My name is Jostein Holmgren. I represent the Research Council of Norway in the THCS partnership, and we are the leaders of the work package that is responsible for drafting the call text. And I will be covering in my section of this webinar the topic for this call, which is well, the title is Access to Care, as has been covered. And really this call is all about funding research and innovation projects that contribute to ensuring equitable access to and utilization of health and care services. So those are sort of the two main pillars or the two main topics of this call. The ultimate goal is to improve health and care system dimensions such as quality, efficiency, equity, and sustainability. So that's sort of the core principles of THCS that this call ties into. First of all, just to go through why this particular topic was selected. And as a sort of foundation, is the European health and care systems are under significant pressure, both financially, geopolitically, and climate change is increasing burden. Immigration is an ongoing issue in Europe. So as a result, there is a great need for comprehensive transformation of health and care systems. But crucially, this must also address existing inequalities, and the transformation will obviously also not cause new inequalities to occur. And these kinds of inequalities are many, but in this particular call, we are looking at inequalities in access to and utilization of health and care services in the way that they contribute to health disparities. There are many factors that contribute to these, but major ones include geographic disparities, and this could be the urban-rural divide and the lack of lack of health and care services locally in rural areas. But we're also including in this so-called medical deserts in urban areas that aren't necessarily remote, but they are underserved for other reasons. We're also covering here language and cultural barriers, which is particularly migrant health is covered by this, but also other disadvantaged groups in that are not migrant groups. There are also issues as more and more digital systems are introduced in health and care services, that digital literacy becomes a barrier to entry, and that is also covered by this call. And of course, costs for both public and private health and care services can be very prohibitive for individuals, and is one major barrier to access. However, these are just to highlight some of the major barriers that apply, but of course other factors exist and are also covered by this call. In addition to the access to health and care services, we know that different patient groups and different populations groups have different usage patterns of health and care services that contribute both to overutilization of health and care services and underutilization of health and care services. And this contributes to unequal health outcomes. This dimension of access to care is also covered. Now that's the background, but then looking at what this call wants to accomplish through its funded projects. First of all, is to contribute to equitable access to and utilization of healthcare services. And within the scope of THCS, we are really looking at projects that can bring the innovations into reality and into the real world on a relatively short timeline after the end of the project. So therefore, projects should build on existing evidence. And of course, they should still deliver innovative solutions, but they should not start at a very basic low level and build the solutions. They should build on the range of existing evidence that already exists to have a shorter avenue to implementation. Proposals should develop measures that compensate for disparities in access to health and care due to one or more of the following factors: socioeconomic status, geographic location, racial, cultural, or gender identity, literacy and language barriers, or limitations in infrastructure and workforce capacity. As I mentioned previously, one of the dimensions that is included, but is not mandatory, but is included under the umbrella of this call, is to investigate how access interacts with patient usage patterns and propose solutions that contribute to reducing under and overutilization of health and care services. And this is a dimension where there is a larger knowledge gap on what is the actual impact of different patient usage patterns on their health and care access. So we anticipate that there's a bit more of a knowledge generation aspect to proposals that cover this particular dimension. This call mandates collaborative transnational research, innovation, and assessment actions. What we will cover this more in later sections of the webinar, but what this means is that all proposals must have a minimum of 3 partners from a minimum of 3 countries or regions that are covered by the funding of THCS. It is compulsory to engage in one of the following: applied research, implementation research, piloting, upscaling, and/or testing. I want to highlight that projects must be taking an ecosystem approach. This is for those who have seen our previous webinars and who have maybe applied to previous THCS calls, might be familiar with this. But this is effectively an approach that really emphasizes the involvement of all relevant stakeholders, and that this should be real participation, often in the form of co-creation and not mere consultation. In fact, this is so core to the philosophy of THCS that we have a separate section later on in this webinar to specifically cover the ecosystem approach. And I want to emphasize that this is not just an added bonus, this is a requirement for all proposals that are submitted to this call to be taking an ecosystem approach. So we strongly recommend that you stick around for this dedicated section on ecosystem approach later on in this webinar. The proposals are expected to deliver, as I mentioned initially, concrete, feasible, actionable, and transferable results that contribute to reducing inequalities in access to healthcare services and to reduce over and underutilization of such services. And here this is what I alluded to initially, is that all proposals are expected to deliver results that are applicable in the real world, that can be implemented into the health and care system at a relatively short time frame after the end of project. Then it must be concrete in the sense that they cannot be hypothetical. They need to be clearly described and developed already at the stage of application. They obviously need to be feasible, and actionable transferable relates to that they must be usable in practice, and they must be possible to transfer from one setting to another. And in fact, part of the output of the project will be is expected to be strategies for how to transfer and scale up the innovation. Digital tools and other technologies can be part of the innovation or may support innovation, but it must not be the main focus. THCS is a partnership that is about health and care system research and innovation, but it is not about technology development first and foremost. Applicants are expected to actively involve, as I mentioned, in an ecosystem approach, relevant stakeholders. Proposals must describe how outcomes will be transferred and scaled across diverse contexts and how adaptations will be made to local systems and needs. Finally, I will just cover some explicit rejection criteria. First of all, and again, this is really just to emphasize this point, if they do not take into consideration an ecosystem-wide approach, they will be rejected. If they fail to consider end-user perspectives in the design, implementation, and evaluation phases, they will be rejected. If they're limited to epidemiological or descriptive studies, such as mapping prevalence and analyzing risk factors, without proposing concrete actionable solutions or models for implementation in health and care systems, they will be rejected. If they focus predominantly on clinical, preclinical, or biomedical research, that do not address systemic, organizational, or social components within health and care delivery, they will be rejected. And finally, if they relate solely to welfare services and do not address issues related to health and care services. However, just to make it clear, welfare services may be part of a project, but they must not solely be about welfare services. On that note, I will hand off to the next presenter.
Yeah, thank you, Jostein. I will continue indeed again about the call procedures and criteria. It are mostly first some practical aspects, and then we go a bit more to the background. But first, the timeline. We have two phases: the pre-proposal phase, with a deadline of February 2. And we have the full proposal submission stage with a deadline of June 30. And we expect, as you can see also on the screen, is that the projects will be recommended for funding in the end of October from 2026. After every phase, we have a written evaluation. But first, we always have an eligibility check, a general eligibility check, if you follow the rules from THCS, but also on a national and a regional level. After that, we start with a written evaluation, a peer review panel meeting, and after that, the call steering committee comes with a list, with a ranking list, and on basis of that, will be decided which proposals will be invited for the full proposal phase. And after the full proposal phase, we have the same steps, but that ends up in the project recommended for funding. So that's more or less the timeline. Let's continue, because you can also find it in the context. As we also see in the chat function, a lot of questions are asked, but please also check the context, because actually most of the answers you can find there yourself. Let's see some practical things. Project duration of projects can be minimal 12 months to maximum of 36 months. Some funders only allow a maximum of 24 months, so always take care that you read the national or regional eligibility criteria as well, so that you're not surprised with any limitations. The number of partners in a project in a consortium can be 3 minimally and a maximum of 9. And there is some extra rule that from the partners in a project, they should be from at least 3 different countries. And from these 3 different countries, at least 2 of them should be an EU member state or a Horizon associated country. Well, you can read all in the context again with all the details. In every proposal can be a maximum of 2 self-funded partners. We call these self-funded partners, we call them collaborators. In any circumstances, the coordinator of a project should always be eligible for funding. And also an important aspect, what we want to ask your attention for, principal investigators can submit up to 2 proposals, of which maximum 1 as a project coordinator. We saw in the last years that sometimes it goes wrong, so please be aware of that. A maximum of 2 proposals, of which only 1 as a project coordinator. Well, there's some practical information. Let's continue. If there's more to say about it, yeah, as I said already, you can find all the information in the call text. And also don't hesitate to contact your national or regional contact point if you have any questions, and also to be sure that you follow all the regulations well. Also, a question frequently asked, well, if your funder is not in the list, and I mean that the list in the call text, if your funder is not there, or there's no funder from your country, it means you cannot get funding and you can only join as a collaborator. Well, some other aspect, double funding is not allowed. Well, it speaks for itself. And also for enterprises joining the proposals, be aware that there are some regulations you need to be aware of with regards to some funders. So that's also a point I want to raise. Eligible cost. Well, you see here on the screen the list of costs which are eligible, but also on this aspect, every partner should adhere to their own regional and national regulations. So check that carefully if you fill in the budget table, because if a project is selected for funding, then every partner in the projects needs to ask for funding from their own national or regional funder. So that's why it's important to be aware of that also when you submit your proposal. Here are some key considerations for a successful proposal. Multidisciplinary teams, intersectoral collaboration, for example, the development of really sustainable strategies which will really last longer. Stakeholders, the inclusion of stakeholders is very important. There's also a lot of information in the call text about it, and I will tell you a bit later a bit more about the involvement of patients and end users, for example. For example, it's also important that you integrate with the broader ecosystem, but my colleague Gerda Geyer will talk more about it after me. Focus on interdisciplinary research and the inclusion of underrepresented populations, for example. We also find it very important as a key consideration for a successful project. The question is for you important, of course, like how is a proposal assessed? Well, in the call text, you see in all the details what the criteria are. They are divided between excellence, impact, and quality and efficiency of the implementation. And on the screen, you see more like a summary of all the aspects of the evaluation criteria. So also be aware of that, and also with a lot of questions, if you read there, that are the aspects that the peer review panel will take into consideration. So this is their assignment to evaluate the proposals on these aspects which are written down in the call text. There is also always an ethical clearance process for the projects who are selected for funding. Here you see how the process works. An ethics board will assess all the proposals and give either ethical clearance or conditional clearance. But if the ethics board don't give clearance or also not conditional, then the project cannot be funded. So it's very important to be aware of it, that it's a step which needs to be taken to assure that the ethical issues are also covered. So that's about the ethical clearance. You find our submission platform if you go to the THCS website and select the goal 2026. We use a special platform from EPSS, and here on the screen you see how it works. You can just sign in or register if you didn't register yet, and actually everything will run smoothly. Here is the information that you need to show in the pre-proposal. And an important aspect is that from this year on, we have you need to fill in everything in the online form. We have this application template, but that's only for your help, to help you to collect all the information. But if you submit your proposal, you need to put everything in the online form. There are only some small annexes which are allowed. So be aware of it. You cannot add the template to your proposal as an annex, but you need to fill it in. Now, those are all practical things. I'm sure you can deal with it, and otherwise we are always there to help you out. Please be aware also of the timeline, that if you are in trouble, that you have enough time to contact us and get our assistance. But I must say, last year we also used this submission platform, and we are very happy about the possibilities. So that's positive. Again, the timeline, I will not talk you through all the different steps, but the most important is that the pre-proposal stage ends at February 2, and we send out the invitation for the full proposals in the beginning of May. So that's also that we send out then to the applicants which proposal is not going to the full proposal phase. So that's good for you to know. And you can find it in the call text. So this is the timeline. So these are the practical aspects shortly. And then I continue with the aspect of patient and end user involvement. Also there we find it very important within the THCS partnership, and we also put effort to add it to the call text. And yeah, the question is sometimes like, why is the involvement of patients and end users so important? Well, there are key involvements because patients and citizens are really offering insights in the needs they have and the challenges they face. So that's really a key point of the health and care system. We find it important that projects are grounded in real-world experiences and are truly relevant. So that's also a reason why it's important. The participation really makes it possible that the research is relatable and reaches the needs of the people. And it also ensures that the solutions which are developed are not only practical, but also embraced, and they are meant to serve and to help strengthen our health and care systems. So that's also what's written in the call text, but I want to make sure that you are aware of it. How can you involve patients and end users? you can do it in different ways. For example, as a formal partner within a consortium, but that depends a lot on the funder. So also on that aspect, read carefully the regional and national criteria to see if it's possible for the funder of your country. Of course, you can also involve patients and end users as a consulted stakeholder, by let them contribute in their dissemination and exploitation activities, and also in participation in the project. So there are actually a lot of ways. And the most important is as well, that's why I also added it to the presentation, is that it's also part of the evaluation criteria. For the excellence, you see the appropriate engagement and consideration of perspective from stakeholders and end users, including the patients. So that means that it's also important to add it to get more insights, get more chance to get your proposal to be funded. So that's about the involvement of the patient and end users. If there are any questions, I don't see questions now, then we can continue with the ecosystem-wide approach. I invite Gerda Geyer to give us more insight into the ecosystem-wide approach and why it's important for the call 2026.
Yes, thank you, Ewout. If you let me share my slides.
Let me see if that's possible.
I still see your slide. If you take it off the screen,
yeah, you can
share mine.
try.
Right. So here we are, the ecosystem-wide approach in funded projects. So hello, everybody. It is a pleasure to be here in this meeting. My name is Gerda Geyer. I'm from the Austrian Research Promotion Agency, FFG. And we are in THCS in the lead for the work package on strengthening ecosystems, supported by the co-leads Tampere University and the Dutch funding agency SUNEMWI. In addition to the work package activities, FFG is also acting as the national funding agency for Austria. And in the following minutes, I will be happy to briefly talk about the THCS approach with respect to strengthening ecosystems and especially what this means for funded projects. So as you know, it is the main aim of THCS to foster the transition towards people-centered health and care systems enabled by integrated services, both across and beyond traditional health and care boundaries. Now, for transformation actually to happen, changes at different levels of organization are necessary. There is the micro level. The micro level is composed of individuals, of teams, of small groups, or units within organizations. Those people might need to be empowered to be able to support transformation. They might need additional skills, but also a mindset shift, as well as ensuring their engagement. They have to buy in the transformative approach so that it actually can happen. The micro level is really very important. Then the second level is the meso level, that is the organizations, the communities, the institutions or networks. In order to change them, a redesign normally is required. This might entail cultural changes, structural changes, or also changes in leadership. Then the third level is the macro level. The macro level is, for example, the government, the policy level, the national systems, the societal norm, the financing aspects. In order to support transformation, an alignment of policies of institutions is required, but also societal values need to change in order to enable systematic transformation. Now, it's important to see that all of those levels do not exist only by themselves and for themselves, but there need to be a continuous communication and feedback loop between the different levels in order that transformation can happen. Otherwise, it loses legitimacy and also momentum. And this leads me to the ecosystems. It is the notion of THCS partnership that the actual transformation of health and care systems need ecosystems to be in place and operative. And there is a very broad definition of ecosystems as different actors working together, actors stemming from different entities, from regulators to end users organizations, from funders to service providers, from governing bodies to health and care professionals, from NGOs to companies and innovators. So you need that kind of constellations of actors, and what is very important is that you need to have the right composition of people in order to drive the change. That is, leaders who embrace new ways of working together, or also early adopters can play a very important role in encouraging others to experiment with new ways of thinking and collaborating. Now, the ecosystems, as also the transformations, can be active at different levels. The micro level would be small ecosystems, for example, around a specific technology or around a specific process, but still aiming at contributing to a transformation. They are always not limited in time in working together. At the meso level, it would be more the regional approach, for example, around several health and care issues where you aim at obtaining transformation. And at the macro level, it would be ecosystems that create the rules of the game, that do the regulations or provide the financing. And also here, it is important that the different levels need to be in constant interaction, because at the micro level, if you try to change a process or introduce a technology, it will still be necessary to also reach out to the macro level ecosystem, because you need, for example, financing for it. And the meso level is always very important because there the processes are defined. Then with the ecosystem-wide approach in funded projects, you might ask yourself, what are the dimensions that need to be taken into consideration? And I think the most important thing to remind here is that we would like you to broaden your project approach, not be only focused on your consortium and on the project outcome, but look beyond and try to understand the circumstances and the environment at your national, regional, and local level. What is the interest of the actors there? What is the interest of the micro level, of the meso level, of the macro level, and try to connect to those actors. So you still need to also contribute to the THCS goal of meaningful and sustainable transformation of health and care systems. And you also need to take into consideration the relevant key actors across the different levels of system transformation. An important question for you to ask yourself might be, what level of transformation are we actually aiming at? Is it the micro level, is it the meso level, or is it the recommendation towards the macro level? And then you can look of how to include also the other levels so that your approach, your solution, or your project is relevant to the different kinds of actors beyond your consortium. That increases the chances of sustainable success for your approach or for your solution. Then, of course, also the consortium composition is very important in terms of ecosystem and in terms of sustainability of your approach. It is very important to look for partners who have a transformative potential, as well as the partners among themselves complementary expertise, ideally covering the end user's perspective, the policy perspective, the business perspective, and all of this integrated by research activities. Partners should also have a vital interest in the project idea and in seeing the results implemented. When the transformative outcome of the project also fits the single partner's organization strategies, then the chances are really increased that they will have the motivation to continue also after the funding ended. I've already seen in the chat that there were questions, are you then also providing funding for the implementation, and how are you then dealing with the outcomes of the projects? But it is also a task for the projects at the proposal phase to think about the sustainability and to think about creating the relations and the connections that are necessary for actually ensuring the sustainability. Then the activities in relation to the stakeholders need also to be included in the work plan. You can also see it here because, of course, the relation with the stakeholders, with the end users, with the policy level, with the organizational level, that is of interest to your approach and your solution also requires some dedicated resources. And if you do not have the resources planned, it's very likely that you will not have the possibility of actually putting that in action. So please also take into consideration the resources that you will need in order to be able to continuously be in touch with your ecosystem and include the ecosystem wherever it is necessary, like also in the co-creation of the solution and of the approach. So resources is really very necessary. And then when it comes to the implementation of the approach or of the solution, also the dedication of some resources to the development of a business model could be reflected in the work plan, but you need to anticipate that and include it right now when you are designing the proposal. So then over the last couple of months, Work Package 9 on strengthening ecosystems has also dedicated some resources to identifying transformative ecosystems around Europe and to analyze some of those transformative ecosystems. And we have found some indicators for enablers of transformation. And what we have seen in analyzing the transformative ecosystems is that it's always important to keep in mind that it's people that drive change. Transformation is actually put in place by committed individuals. Then an ecosystem or a consortium needs also a shared sense of urgency in order to really work towards a commonly agreed aim. Then the political support is always very helpful in then implementing the approach or the solution. And the credibility through groundwork in terms of a robust measurement and evaluation framework helps a lot in order to guarantee the sustainability of the solution or of the approach. Then the integration of citizens and service users or end users or patients is just really an essential thing in order you to be able to design and develop the approach or the solution in a way that helps and benefits the end user. So take them into consideration right from the beginning and not just at a later stage. And then one other thing that we have learned in analyzing ecosystems is that, of course, there is no universal formula, and you always need to find a solution for the very specific circumstances that you find yourself in and the partners of your consortium in, and reach out to the stakeholders at your national, regional, and local levels. Then here I have a few links to additional resources. There is the deliverable 9.4 on the activities in relation to ecosystems that we have done in our work package that might help you to understand even more the concept of the ecosystems and the importance of the ecosystems for your proposal and for your project. Then the transformative ecosystems that have been analyzed are available also in the Knowledge Hub. Please sign up for the Knowledge Hub and browse through the resources that are there. And we also have a brief video on our last workshop in Vienna on strengthening ecosystems. And last but not least, I would also like to draw your attention to the so-called legacy study that was done by the AL program that shows very clearly that the involvement of end users and the reaching out to the stakeholders and the taking into consideration of the ecosystem is not just a request that we pose on you as the national funders, but it's also something that really helps you to create approaches and solutions that are sustainable and that are really information-based and that have a higher chance, and that could be shown by the legacy study, a higher chance of actually being available for a longer duration and in a sustainable way. So that's from my side. Thank you for your attention, and I give back to my colleagues from Suneway. Thank you.
Thank you, Gerda, for the information about the ecosystem-wide approach. We end up with an explanation on the partner search tool. Martin, can you give us some information now about the partner search tool? And then we have some time for the Q&A.
Okay, so I will share my screen now. Can you see it?
Yep, you see your screen.
Okay, so hello, my name is Marcin Chmielewski, and I'm representing the call secretariat team, and I'm from Poland, from National Center for Research and Development. And I would like to give you some information about, as we said, partner search tool, because we know that creating a consortium is not always easy, and creating a consortium of 3 different partners from different countries is necessary to submit a proposal in this call. So, the address for this tool is partfinder.ncbr.gov.pl, and if you enter this address, you will see this page. This is the main page of the search tool. Here you can see the announcements. You can see the announcing country, the title, and a bit of the project description. And of course, this is pretty much everything that you can see on this main page, because to see more, you need to create an account. So if you press one of the buttons here, you will be redirected to account creation page. It is a very simple process. You just need to put your email and the password. And after receiving a confirmation email, your account will be created. And then you will be able to see more. And you will be able to, for example, see the details of each of the announcements, and also to see, you can filter the announcements on the main page using this specific set of filters that is on the top side of the web page. And you can filter the announcements by type of the collaboration. So you can pick the partner-looking announcements or consortia-looking announcements. By partner type, by announcing country, by keywords, by classification areas, and also by specific call, because this partner search tool is very universal. It's not specific. It's open to very different calls and programs. So you can pick from program call filter, you can pick THCS partnership, and you will see only announcements that are created specifically for this call. And if you are logged into the Pathfinder, you after clicking the details, you will see this. So you will see this is of course the test announcement, but you will see all the details in the specific announcements. So the project description, the partner status, keywords, and everything else. And also you will see the contact details to the author of the announcements. So you will be able to send him, for example, an email and contact him and ask him to create, for example, consortium. And also you will be able to send him a message by this button, the chat button, and you will be able also to send some messages. So in some situations, it can be a lot easier than sending an email. And of course, after login, you will also be able to change your profile, to see your announcements page. So if you create more announcements, you will be able to manage them on this tab. Also, you can add some specific announcements to your favorites, and this is your followed announcements tab with your favorite announcements. And also the chat tab on which you can proceed with your chat discussions with all the announcements you are interested in. And also, what is most important in this partner search tool is a creation of your announcement. So to create an announcement, you need to just click this new announcement button on the top of the page, and you will be redirected to this form. And here you need to fill all the necessary fields. So please remember to fill all of them. If you fill them, the announcement will be created, and it will be shown on this page. It will have the ready status. It is not yet visible on the main page. To make it visible, so please remember to switch the status from ready to published with this action button. When you press it, the mini menu will show up, and then pick the publish button, and then the announcement will be published on the main page, and everyone will see it. If you want to withdraw this announcement or cancel it from some reason, you can also do this from this web page. So yeah, this is pretty simple tool. If you have any problems, any difficulties, or any questions with with your announcements or with your, for example, confirmation email, so please send us something to the pathfinder@ncbr.gov.pl, and I will be able to help you. And I also have some administrative possibilities on this web on this search tool, so I can also help on some of the technical levels. So yes, thank you.
Yeah, thanks a lot, Martin, for sharing this information. We are already reaching the end of the agenda. So we start soon with the Q&A. Just to recall a bit, we started with some information about the partnership, about the call text. We give you some advice on the call procedure and criteria, and some background information. And also with regards to all the questions, please also check indeed the call text to get most of your questions answered. For the contact details, we'll also share them on the screen, and we will share with you the presentation of this webinar. And as you know, we will publish the video of it, the recording on the THCS website. To start with the Q&A, maybe I can ask Jostein, as you are responsible for the call text, can you give some replies already on the questions you read on the call text?
There were quite a few questions I've been replying to in the chat, so I don't think I should go live through and look for the ones that were particularly relevant to me. But what I will say is that we received some questions regarding this, what is meant by existing solutions, and if they should be implemented during the project period, etc. So I thought I could elaborate on this. So the idea of THCS is that the results of the proposal should be possible to put into reality in a relatively short time frame following the end of projects. But that does not mean that the projects themselves should be about implementing the results. In fact, there are generally limits to what research and innovation funding can be used on, and since implementation usually involves some amount of procurement, it's usually not possible to use research and innovation funding directly to implement proposals. So you're not expected as part of your projects to implement the solutions that you propose. However, there should be, as part of your project output, some strategy for how to implement it after the project is finished. Regarding the existing building on existing solutions or existing knowledge, the idea, this is very difficult to give a blanket statement about this because it will vary significantly depending on what kind of project you have. But the idea is that it should be possible to take that you should not start at a point where you need to develop the evidence that the solution works or that it's effective or that it's building on a very strong foundation, and then be left at a state where you still haven't gotten to the point where it can be implemented. And that will vary from context to context, but if you build on solutions that have some sort of proof of concept or some sort of level of maturity, that means that by the end of the project you will be able to start implementing it, then that is the level that's expected. I think that covers the two main questions that I've seen that relates to the topic and the scope of the call.
Yeah, thanks a lot, Jostein. I think so too. I think most of the questions are answered. Maybe there's also a question about the ecosystem-wide approach, if this should be, if all levels of the ecosystem should be represented from all the countries joining the proposal. Gerda, is that necessary at all levels from all countries?
I mean, in the ecosystem-wide approach guidance, in the guide for applicants, we say that ideally a consortium would be composed of quadruple helix partners. That includes the policy level, the end users level, the business level, and the research level. That's the ideal case. You can also take into consideration different levels of ecosystems via your work plan or via letters of intent, for example, of partners that you are aiming at collaborating with in the course of the project. So not all the ecosystem partners need absolutely to be included within the consortium partners. It's the ideal case, but you can also find other ways for having the contact, for collaboration, and for bringing in the expertise and the necessary knowledge.
Yeah, thank you, Gerda. That's very clear. I'm looking a bit like what we can do now, as the questions are a bit scattered in the chat. So I'm looking a bit like what's a good way to deal with it. We will continue for sure with answering your questions in the mail. And as I said before, please send your questions to us by email. We are very much willing to answer your questions, and we will try our best to reply as soon as possible. Some people raise their hand. I invite you, if you have a question, if you want to share it with us, please raise your hand. And for everybody, it's also the end of the webinar. So we will stop the recording, and then if there's any important question, we will share it with you in the frequently asked questions that would also be published on the website. But now there's the floor for the people who want to ask us questions, and let's see if we can reply. Krishna, I see that you have a question, please. So if there are more people who want to share their question, please feel free to raise your hand. And for everybody, thanks a lot for joining us. And we're looking forward to hope you can come up with a good proposal to our goal. Barbara, do you want to ask a question?
Yes, thank you. I'd like to ask what should be the mutual positions across the at least three countries? I mean, should the same idea be implemented in the three countries, at least three countries, let's say, or should one idea adapted with differences according to the context in the other countries? Is that clear?
Yeah, your question is clear indeed. If it needs to be implemented in all the countries, that's not the case. It's of course a project, and partners from different countries can do different works in it. So it's not necessarily that it's implemented in there. Maybe Jostein, you have something to add?
Yes, I could elaborate on this. There is no requirement that the implementation needs to relate to any given country or context or range of countries in the proposals. The solution should apply to European health and care systems, but in principle, you could have a solution be implemented in a completely different country than from any of the participating countries of your consortia. I mean, that might not be sensible, but there's no restriction on this. What is important is that if you develop a solution that is then tested or piloted in a specific context, it needs to be clear how it will be scaled up and transferred to different contexts. And typically, if your context is very specific, either to one country or to one region of Europe, then that might be something that the peer review panel marks down compared to a project that has solutions that are scalable across a larger set of contexts. But this will vary from proposal to proposal, and it's difficult to give a blanket statement on this. But it should be the keywords are scalable and transferable.
Can you hear me now?
Let's try again. Krishna, are you available now?
Can you hear me now?
Yeah, we hear you now.
Okay,
Thank
great.
you.
Sorry for that. I think it was the speaker was not working. I was just saying no response. So
No
thank you very
problem.
much for the presentation. Very insightful. Quick question was if you could share the presentation slides. You mentioned that the recording would be shared, but just to have the documentation.
Yeah, we will also share the slides on the THCS website. Yeah, that's no problem.
Thank you.
Eva, I think you are the next one.
Thank you. Thank you very much. First of all, thanks for clear and nice presentations, very informative. Maybe my question to Jostein. You spoke about involving care and healthcare systems, not a welfare system. What does it mean? How could you explain it, please? Does it mean that social care systems are not involved, or because I think that in our country we would like to focus on mostly on health and social care interface?
Certainly, the limitation is that the proposal cannot be solely about welfare or social care system. I think in the context of this would be more or less synonymous. Maybe slightly depending on which country and which system you're talking about. But the through line is that it cannot be solely about social or welfare systems, but as part of a larger project that also has that also covers health and care services or health and care systems, then both welfare and social care systems and services can be part of the projects.
And it is like whole systems or only segments, because we would like to focus on the interface in long-term care, especially.
No, certainly segments is also okay.
Thank you. Thank you.
You have another question open now. Let's see, Ionut Manuel Angel.
Yes, thank you for the presentation. Very interesting. I have a question. Can a consortium be managed by a technical partner, even if technical part is not the focus?
You mean the technical partner, if it's a funded partner, then it's no problem.
No, I mean, can it be managed by a technology developing partner, not by an end user or by a, let's say, a policy maker?
You mean as a coordinator of a proposal?
Yes, as a coordinator.
That's possible. It's not excluded. Jostein, I see your hand.
I think I understand the question. Each proposal will have a sort of leader of the consortium, but that doesn't necessarily mean anything in terms of the that has some duties regarding to the administration of the consortium, but it doesn't limit anything about the project output. So if the consortium leader is the technological partner, an implementation partner, clinical partner, academic partner, that doesn't really matter. But in general, the management and of the consortium and the consortium structure is part of what the peer review panel will assess. Not necessarily which is the coordinator of the consortium. But as a whole,
okay.
it should be appropriate to the project that you are trying to implement.
Thank you very much.
We have a question from Olivia.
Yes, thank you very much. I just want to double check if I understand it correctly. If we propose a solution that would be scalable and transferable to the system, we are not required to show it is working. We can propose it and at the same time propose how to implement it in the future after the project. Is that correct?
Yeah, that's a difficult question. You could say it's correct, but it's all up, of course, to the peer review panel that they really see the added value of it and really believe in it, of course. So it's on the one hand, yeah, there's a lot possible, but yeah, you should focus a bit more on the evaluation criteria, like what do the evaluators find important based on the criteria they need to assess.
But if we can show it in a pilot, for example, that it is working in a smaller scale, that would be okay, you think?
Yeah, it's not that it's not okay. So we cannot say like what the peer review panel will think about it. We don't think for them, but in general, it's possible. Yes.
Great, thank you very much.
No problem. Thank you, Heidi. Heidi, do you have a question for us?
Can you hear me now? Okay.
Yeah,
great.
we hear you now. Thanks.
So I have a question. So I kind of know the answer, but I wanted to get confirmation. Our solution, it seems like the grant is supporting to develop solutions that can help policymakers for hospitals to improve equal accessibility or something like that. Can our solution is not directly helping that. Our solution is to help medical doctors, not policymakers, to help medical doctors to make better treatment decisions that can improve treatment outcome, and the price is better. And I'm so sorry for the noise. The price is much lower that can help more people to access the solution. Also, it is has access remotely the solution, so it can also help improve equal accessibility. So can we apply for technology?
That's difficult to answer your question. I could not hear it properly. Jostein, did you hear it?
If I understood correctly, you're asking about decision aid systems for clinicians. I think it's without knowing more about your proposal, it's difficult to give specific advice, but it seems borderline. The THCS is about health and care system research and innovation, and as soon as you start to target individual doctors with decision aid, then you are moving more towards a clinical application, which would fall out of scope. But it would depend on if your solution would fit into a project that is looking largely or looking more generally about how you could implement such decision-making systems into a clinic or into health and care service. Then you would probably be better within scope rather than just developing the decision-making system itself.
Helt, så laver noget samtidig.
I think it's very tricky and more like not eligible because we are more like a precision treatment rather than policy making. I see. So I think to be safe, I am not eligible, right? That is conclusion.
I cannot make that assessment for you, but it's if you think based on what we've said that you might not be eligible, then it's up to your judgment if you spend the time on the application or not.
Okay, thank you so much.
You're welcome.
We can continue with Michael.
Hello together. I have a question. It was stated that we have to provide all the partners already in the pre-proposal phase.
Yeah.
What happens if we will add some ones afterwards? Is that possible or needs that to be fixed upfront?
It's more or less fixed. There's only one exception. We have like this widening measure. That means that you can add a partner from a underrepresented country. We don't know beforehand who will be underrepresented country. That will be announced after the pre-proposal phase. But so in general, you should have all the partners in place, and only this widening measure could give you a chance to add a partner from certain countries, but that's not recommended.
As you know, we're talking about health and care, and sometimes clock is running different there.
Yeah,
So,
I know.
so it might take some time to find all the partners. So this might be the risk here to.
Yeah, that's correct. Okay. So I understand your point. Yeah.
Thank you.
Well, I believe there are dozens of questions left, but I don't see a hand at this point, so I think we should finish by now. I will share again our email address so that you can contact us. And thanks a lot also for all the questions. It's very nice to see all your interest in the call. Thank you.